Assalamu alaikum. This is Shamama and today my topic of discussion is cardiac tamponade. This is my last video on the series of videos on cardiac tamponade, and at the end I'm going to discuss today is how we'll treat or we'll manage a patient of cardiac tamponade. So in the management, it's very important that I will start the discussion, but a very important point in the start, that the whole management, it depends on two major points: that what is the condition of the patient, means whether the patient is stable or unstable at the time of presentation. Second, it depends on the type of fluid that is present in the pericardial cavity. Now, taking these 2 points into account, we will start our discussion that how we will manage the patient. So, the whole management, I prefer dividing it into 2 points or 2 columns so that it's easy to manage depending on the type of the fluid. Now, if the fluid is non-hemorrhagic, what does this non-hemorrhagic means? That it is a fluid other than blood. So if it's non-hemorrhagic cardiac tamponade, then we'll manage it accordingly. Or if it is hemorrhagic cardiac tamponade, means the fluid that is present in the pericardial cavity, in this case causing cardiac tamponade, is the blood, so we'll manage it differently. Now, if it's non-hemorrhagic cardiac tamponade, then the second point, that what is the condition of the patient, we'll divide into further 2 parts. That according to the condition, if the patient is stable, how stable? Hemodynamically stable, means all its hemodynamics, its blood pressure, blood volume, and all the vitals, they are stable. Then how we'll proceed in its management? That we will, first of all, what we'll do is that we will prefer monitoring the patient by continuously seeing findings of chest x-ray, of ECG, of echo. So we'll monitor the patient. Second, what we'll do is that we will consider that pericardiocentesis will be done, but when required according to the condition of the patient, not immediately. And if the patient is having renal failure or any kidney disease, then in that case we'll prefer, it's a very important point, someone can ask you, that we prefer dialysis over pericardiocentesis. Mean dialysis is preferred as compared to pericardiocentesis for drainage of the fluid. Now, this is if the patient is non-hemorrhagic and within it he is stable. Moving on to the next condition, of course, next condition is that if the patient is unstable, hemodynamically, of course. Now, if he is unstable, what we'll do, of course, in this case, we will immediately, it's very important that we will immediately perform pericardiocentesis in that patient, and we will drain the, what we'll do in pericardiocentesis, that through a needle we'll aspire the fluid from the pericardial cavity so that patient main symptoms can be relieved, main cause of the disease is relieved. Fine. And when we're investigating the patient, the echo will help in this diagnosis of the site, of the optimal site. So I'll even write here that performing echo, it also echocardiogram, this is just an abbreviation I use, it also provide us with the optimal, of course the surgeon, with the optimal site for pericardiocentesis. I mean, what is the best site at which the pericardiocentesis should be performed. Fine. And second option is that if the patient is not relieved by pericardiocentesis, then we have another option, that fluid challenge is used, and it mostly helps you in maintaining the condition of the patient and remove the fluid basically. Fine. So now we'll talk about the second condition, in which I already told you that type of the fluid is now hemorrhagic, means that the patient is having blood in the pericardial cavity. So in this case, if the bleeding is not able to stop, means like bleeding is unlikely to stop. So of course in this case, now very important, listen carefully, if the bleeding is not stopping, then what we'll do, we won't prefer pericardiocentesis. Very important point, that we won't prefer pericardiocentesis here. In this condition we will prefer emergency surgery, like emergent surgery will be performed, and what we'll do in this surgery, that we will treat the cause of bleed, because that's the only modality we have here, and we won't delay the surgery just for pericardiocentesis. So this is the point, that emergent surgery is preferred over pericardiocentesis. So this is briefly about the whole management of the patient, and how we will manage a patient of cardiac tamponade. Brief overview, depends on the condition of the patient and the type of the fluid. So if the condition is if the type of the fluid is non-hemorrhagic, then patient is stable, so we'll monitor him, do pericardiocentesis, or if renal failure, we prefer dialysis over pericardiocentesis. If he is unstable, we'll go for pericardiocentesis immediately, and echo will help us in deciding the optimal site for pericardiocentesis. And if not benefited by pericardiocentesis, we'll prefer fluid challenge. And second category is the hemorrhagic cardiac tamponade. In it, if the bleeding is unlikely to stop, then we'll prefer emergent surgery and stop or treat the cause of bleeding, so that all the symptoms will get treated. So this is basically how we'll manage a patient. Now my second part of the video is that how this disease will cause complications, and what are the complications. So we just briefly discuss that because of cardiac tamponade, what sort of complications can be seen in a patient. Now I think it's no need that I tell you those complications, because if you have heard my video on pathophysiology, you can easily tell the complications by your own self. How? Let me recall that in a patient of cardiac tamponade, we studied that it's having two major problems: decrease in venous return, decrease in cardiac output. So because of this decrease in venous return, what sort of complications can occur? That fluid overload will occur. So it's just a way to remember the complication. Never ever cram anything, just go for concepts, it will help you a lot. If venous return is reduced, what will happen? Fluid will backpool, fluid will accumulate in the body, and when it will accumulate, what will happen? That fluid overload will occur in the body. So two complications can develop, that edema can develop in whole body, so we can call it systemic edema, or more commonly peripheral edema will develop. Second complication is that this edema can develop in the pulmonary circulation through, so pulmonary edema will develop, that is a life threatening complication. Fine. Because of this decrease in the venous return, these two complications develop. And now second problem we have is decrease in the cardiac output. Less blood is going to the body. So because of this decrease in the cardiac output, what will happen? That patient can go in shock condition. So shock can develop in the patient. The left heart, now since it's receiving blood and it's pumping more and more and more, but at a point is reached when our left heart will unable to pump blood into the circulation, leading to the left heart failure. So that is a severe complication here, shock, and ultimately death can occur in the patient. So these are the complications that will be seen in the patient, and these are the life threatening complications, of course, which can lead to death of the patient by cardiac tamponade. This is all about the cardiac tamponade, my all series of videos on cardiac tamponade. I hope you like the videos. I hope your whole concept is now clear about cardiac tamponade, about its all points, and you have no need to cram it all. You can just easily listen these videos and recall the whole concept by your own self. I hope you like the videos. Thank you so much for your support and for listening me. Please like, share and subscribe my videos. Thanks a lot. Allah Hafiz. See you in the next video.